Monsieur le Ministre, bonjour.
Bring him in. Mr. Minister, welcome.
Merci d'être avec nous.
Thank you for being with us.
L'emploi du temps est plus que chargé.
I know how heavy your agenda can be. Mr. VÉRAN, I have a lot of questions for you. Well, thank you for inviting me. And this is the first time I come here, and it's a great, beautiful place. Yeah, but it's not, we do not have the mountains, Guy, I'm sorry. Yes, absolutely. But let's look at the future. We're not going to talk about the pandemic. We're going to think about the future, trying to rethink the organization of prevention, care, and rehabilitation from top to bottom in the light of what has just been experienced. And there's a lot to do. A lot of money has been put on the table, and you continue with the new finance bill to provide fuel. Thank you for that. But the institutions and organizations have remained more or less the same. And the One Health concept of global health obliges us to get out of our little chapels that ignore each other while spending a lot of energy for nothing. So first topic, public health, the poor relation of the system, the last internship choice with occupational medicine. Aware of this issue, you launched 3 missions to turn to try things around. The first was entrusted to Franck Chauvin on the organization of public health. Second, to Odnia Danou and Pauline Martignot for public health. And third, to Julien Delpech and Eric Vibert on flash training for health professionals. Well, says the minister, first of all, you don't change things in the middle of a crisis. You need to be reactive. You need to adapt quickly. By definition, when you have a crisis, whatever it is, it means you haven't anticipated it. Otherwise, there would be no crisis. A pandemic, which is related to an unknown virus which emerges on the planet, by definition cannot be anticipated. So the question is, did our tools, the tools we had, the tools we have now, enable us to react as best as possible to the crisis? So Santé Publique France is a great tool. It performs very well for prevention campaigns, for general public health questions. The territorial network has increased with, in particular, the health agencies and what we call the CIR. But in terms of management of sanitary crisis, we'll have to think about it in order to be able to strengthen our tools for prevention and reaction. This is the mission that was entrusted to Franck Chauvin. And in fact, above and beyond that, he's supposed to reorganize public health organizations and schools. Public health is a great discipline. I'm not sure that all French people know what it means. If you ask the question, they wouldn't be able to tell you what public health is. But if you think about promotion, prevention, management of health crisis, it's more explanatory. So we need to diversify profiles. We saw that during the crisis. We need the people in the civil world, in the military world. We need engineers. We need people who think, people who act. We need to strengthen our logistics structure. And the vaccination campaign has shown that. There's the issue of training, flash training for health professionals in case of health alert. We're not that bad in France. Between the first and second wave, thousands of healthcare professionals were trained for resuscitation gestures for patients with an acute respiratory syndrome and to be able to help out. A lot of nurses went to help in resuscitation, and they really helped them. So a number of stakeholders learned how to manage a crisis. Yesterday, general manager in the regional health organization was telling me he had to learn how to manage health Excel tables to be able to dispatch the vaccine doses. The third mission was very important. It's a group of young people, absolutely great young people who did remarkable work. I wanted to entrust this task to young people who are not experts in public health, do not have necessarily an expertise, but who know what is necessary to attract the youngsters to public health through nutrition, sports, etc., and how we can get rid of the usual codes to attract young people to public health and to use new tools in order to be able to define their own public health. So I believe in the future we're going to have something which is really interesting and innovative. Well, hospitals are a highly pyramidal structure with a center that manages the careers of 45,000 hospital practitioners and thousands of part-time staff. Couldn't we organize differently? In '91, there was the Liberty Amendment to reorganize hospitals. Only 2 hospitals decided this. Couldn't we work differently? Let hospitals organize the way they want, hire who they want. Why this heavy organization? It doesn't fit with the flexibility of One Health. If the question you're asking is about the statute of hospital function, for me, it's very important for historical and practical reasons. Hospitals have a possibility of working. Obviously, they're at the bottom of the demographic wave, but they're going to pick up. But the first job of hospitals is not to know who they're going to hire. The idea is to have enough doctors to fill in the plannings. So I'm in touch with hospitals who want the regional health agencies to help them out with the right resources in times of need. But for the wider issue of hospital autonomies, what we noted is that in time of crisis, we got them out of the public tendering process. And what happened? A hospital was able to buy from one day to the other huge stands in a sports shop to house the patients. Everybody was going in one direction, taking care of COVID, saving lives. Everybody got organized. The hospitals talked to the general public much more than in the past, and they still do. There was, I saw meetings with everybody, hospitals, clinics. Everybody was talking to each other, and everybody was cooperating much more than in the past. So we have to continue organizing that. Then what I wanted is for a large part of the Code of Public Health not to be applied to some of the hospitals. Look at the third pillar of Ségur. Hospitals who want to recreate units can do it. Those who want to get rid of a unit can do so. So review your governance, review the proposals of your representation commissions. Don't take unilateral decisions, but we have to use this sequence and the guide prepared by Olivier Clarisse, who did a great job, to see what the hospital of tomorrow could be. There are hospitals in other countries that work with very innovative organizations, and people are very happy there. I would have wanted to do more, Guy. I would like hospitals not to be under the Code of Public Tendering, but under European law, even though I am deeply European, does not allow us to do that. So without changing the statute of hospitals, because it's very important, doctors told us that for them it's very important to be part of the civil service. Well, we observed that veterinarians were not very much called upon in the pandemic for the tests and for some issues of vaccination. How do you intend to collaborate between human and vet medicine? Especially, we have Julien de Normandie later on today. Are you working together? Well, this is the very concept of One Health, the topic of this Congress. because France will be at the head of the EU from January 1st, and the idea is to say, okay, you cannot have human health if you do not treat animal health and environmental health, and the pandemic has shown that. So this is important for Europe in the coming years. Well, I did associate veterinarians when I saw that the ability of the labs, for example, could help out, and that the tests that were batch tests for cattle could apply to unit tests for human beings. In the past, it wouldn't have been possible, but now with the pandemic, we've worked much faster. We've worked a lot on innovation, training, research, and the history of medicine and vaccination. In fact, Jenner had developed the first campaign of vaccination based on the pox virus in cattle, seeing that you could apply it to children and then apply it at a large scale. So at lunchtime, I'm having lunch with experts from the whole of France to talk about the lack of fertility in our country and the role of environmental factors on that. So we realize that things are happening. First of all, they're low noise, but you shouldn't wait too long to see the consequences. So you must develop research and professional training. It's true that for Calmette and Guérin bacillus, the BCG, it was discovered Guérin was a vet. So the social affairs inspection is thinking about a future project of distribution of the roles of social security and complementary organizations. What is the role you are thinking of for this new pillar of social protection? You want to put me in trouble, says the minister. Well, I am in favor of compulsory health insurance. The main strength of our health system is to avoid the scattering of the insurance system. In the U.S., a couple from Ohio has to pay about 50% of their income to be insured, which means that they put more money for the same result. So I also feel that there's a position for each of the stakeholders in social protection, but things are changing. You talk about prevention, care protection for chronic diseases. We talk about sports health, well-being health, etc. All these areas are areas where complementary insurances have a role to play. So, on the other hand, I know that with the simplification of health insurance contracts, with this new stratification, what people have to pay, it's still very a complex system with several hundreds of organizations. And the cost of management is very high and is still increasing for French people. So when I got to the ministry, what I wanted was not to make a proof of concept, but we note that if you have 100% insurance for COVID, for all the tests, vaccines, and telemedicine, no one complained about that. We went from 10,000 to 1 million telemedicine acts per week. Why? Because it was very simple. What I decided was deeply sham, as you could say. You can do it through WhatsApp. You could do it anyway. Why could nurses not do telemedicine? My mother, when she had a hip replacement, was able to have this telemedicine consultation with physical therapists. So if you'd asked people to show their mutual insurance card on the visio conference, it wouldn't have been possible. So we made it easy. But what I asked I asked the Council to look at this. Why not look at this question? Sometimes in this country, just by asking a question without even having an answer or project, people get worried. So what I would like to say is that the more worries, the more it's interesting to look at what's happening. So you exchanged a lot with your European colleagues, and so you think that through Europe we can impose a One Health policy more than through national policies, or is it both? Well, says the minister, there's no one answer. It's both. At my first international meeting, I'd been a minister for 6 days. I got an agreement with 8 neighboring countries. You know how it happens. Teams are moving around. I had penciled something on a paper, and there was a question about restriction of major events, border issues, and everybody signed, but it only held up for 24 hours because the next day someone said, no, we have to take other actions. And there's not every day almost I talk to another minister. Yesterday the Austrian ministry was calling me to talk about health flush training for nurses. But the main example is the vaccination campaign. We started very small, 4 countries. I didn't want to go and see the labs altogether because it would have taken time. We worked with Germany, Netherlands, Italy, and France, and we got a contract, and we opened up to the European Commission, which enabled Europe to be the top manufacturer, and the first continent to export 50% of its production to the rest of the world. And something else, with the French presidency, I'm going to support the HERA agency, which is the European Agency, Health Emergency Response Authority. It will not work instead of the national agencies, but on top of it, and will enable them to work together and work better, because the previous system didn't show its efficiency, especially CDC. So there's this HERA which is being built. But if we think of Périsol in Rouen or AZT in Toulouse, we haven't got health SWAT, so to say. Could we have a system so that something can be done in case of a nuclear or agri-food accident? Well, the first question I had was, what is the know-how we need to keep in our country? So, Lubrizol, next to Rouen, I'm not certain that the first people who were called to get information were occupational practitioners. But who better than these know the toxic products and the risks for health? Occupational practitioners know that better. When you have a school which has the steams with pesticides used in the vineyard that are threatening. Who are the best people to know about the risk of these products? So what is the regional organization that we organized during the crisis? We organized the systems that were useful. So we are reorganizing things, and it has to be done properly. And I'm trying to develop environmental health in the territories. The regional health agencies should be able to do training, prevention, and also interaction on the spot when there's a risk of a cluster of anomalies that might have an environmental origin. Right away, we do some synthesis work in the field. Very often, we work by sector, by environment. You'll have an expert in water quality, one in atmosphere quality, but you need a doctor who says this is the general status of health as it has to be defined in full transparency transparency as we did during the crisis. So if I understand right, HERA will only take care of transborder issues? No, it will also have some work to do in terms of competencies, research, so there will be interaction with them on these issues. Well, that's it. Thank you very much for coming, Mr. Minister.